classmates and teacher. So I'm from group 2 and the first presenter, my name is Akila, and I'm going to talk about epilepsy. So this is my case scenario. So Mr. Shaky Lee, 33 years old, was brought into the emergency department by his wife as he suddenly fell to the ground and started to have uncontrolled jerking, as well as wet his pants and lost unconsciousness. He also had difficulty with coordination and appeared to be confused. He had complained of frequent headaches previously, and thus the doctor started him on IV lorazepam 4 mg stat and PO sodium valproate epilium CR tab 300 mg BD times 112. So today, this is the outline for my group. So I'm going to talk about the probable diagnosis, the pathophysiology, and the risk factors and clinical manifestations, while the diagnostic tests, assessments, medical and surgical management, nursing care, and so on will be followed by my team members. So my team and I have come up with the probable diagnosis, which is the epilepsy. And what is the pathophysiology of epilepsy? So epilepsy is typically viewed as the shift in the balance between the excitability, which is the stimulation, and the inhibitory neurotransmitters, such as the GABA, in favor of the latter, resulting in dysfunction of regulation of the muscle tone, thus causing the firing of. So now I'm going to talk about the risk factors. There are two risk factors, such as the known factors as well as isolated seizure episodes in healthy people. So in the known factors, one of them is birth defects such as intellectual and developmental disabilities, trauma or brain tumor such as cerebral palsy, metabolic disorders, as well as Alzheimer's disease. For isolated seizure episodes in healthy people, we have high fever, infection such as meningitis, exposure to toxins, as well as metabolic or endocrine disorders. Thus, I'm going to pass the next slide to my teammate Adawiyah.
My name is Adawiyah. I'll be talking about its clinical manifestations that are divided into 4 components. Firstly, simple and complex partial seizures are known as focal seizures, which are resulted from abnormal electrical activity in one area of the brain. Simple partial seizures do not alter consciousness, but it will change the way things look, smell, feel, taste, and sound. It will also result in the involuntary jerking of a body part, such as arm or leg, and spontaneous sensory symptoms such as tingling and hallucinations. On the other hand, complex partial seizures alter consciousness, which means that one will actually stare blankly and will not respond normally to its surroundings. Unusual smell and deja vu are some of the examples that trigger seizures. Next, absence and tonic-clonic seizures are generalized seizures which involve all areas of the brain. Absence seizures, known as petit mal seizures, often occur in children and are characterized by staring into space or subtle body movements such as lip smacking and eyelid fluttering. It may also occur in clusters and cause a brief loss of awareness. Tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of seizures and can cause an abrupt loss of consciousness, body stiffening and shaking, loss of bladder or bowel control, or biting your tongue. If we look back to the case scenario, it is said that Mr. Shaky had lost his consciousness and wet his pants, as well as uncontrolled jerking of his arms and leg. Therefore, tonic-clonic seizure could be the possible seizure episode. Now, I'll be talking about the tests and assessments done to diagnose epilepsy. Firstly, history taking of the previous epilepsy episode should be obtained by patients and observer because the duration and actions will determine the severity of seizure. In this case, Mr. Shaky's wife is the observer and is reliable to obtain information. Secondly, physical assessments done are based on neurological and psychological function. It is determined that Mr. Shaky has difficulty with coordination and appeared to be confused. Thirdly, for lab investigations, full blood clot and renal planner are the common investigations done to assess the blood levels. If necessary, lumbar puncture is done to assess the cerebrospinal fluid. Lastly, CT scan, MRI, and EEG are the common tests to determine abnormalities in brain to confirm diagnosis. Thank you.
Hi, I'm Diana. So thank you Adawia for just presenting. So now I'll be talking about the medical management and also surgical management, and also how do you care for patients with seizures. So one of the medical management is that patients are prescribed with regular and common anti-epileptic drugs, which is phenytoin, diazepam. So what does phenytoin does? Phenytoin does not cure epilepsy at all, but instead it is effective against most types of seizures except for absent seizure. It can also reduce or control most seizure activity and has also anti-dysrhythmic activity. For diazepam, it's useful for suppression of abnormal neuronal foci that may cause seizures, calming without strong sedation and skeletal muscle relaxation. So secondly, we will talk about the vagal nerve stimulation therapy. What does it do actually? It does not stop seizure, however, it improves quality of life and reduces the number of electrical activity. So how does this work? A flat battery or stimulator device is implanted in the chest wall, and electrodes are threaded under the skin and wound around the vagus nerve in the neck. However, therefore, this device sends out regular small pulses of electrical ender to the brain via the vagus nerve. And lastly, we'll talk about the ketogenic diet. So what is ketogenic diet? Patients with epilepsy have to modify their diet in terms of high in fats, adequate protein, and low in carbohydrates diet to control the seizure. So what are parts of the surgical management? So what's the purpose of it? Is that it is to actually ensure that patients' uncontrollable seizures are reduced and controlled with further management through surgery. So what are some types of surgeries done? Firstly is the removal of epileptic focus. For example, we have the mesial temporal sclerosis, which is a temporal lobe epilepsy, which means we remove the focus as to where the epilepsy is coming from, and also which is the temporal lobe. So we will just remove a part of it, which is the focus of it, and then to just reduce the seizure. Secondly is the anterior temporal lobectomy. Thirdly, callosotomy, which is the corpus callosum removal. And lastly is the subpial transection, shallow cuts on cerebral cortex. So how do you nurse patients with seizures? Because patients with seizures usually do not have epilepsy, but patients with epilepsy will have seizures. So how do you manage that? So firstly, you move the person away from any obstacles that can cause injuries. Secondly, we cover patient to lateral side and do not hold the person down because patient is uncontrolled and you cannot handle them. Thirdly, ensure clear airway by assessing their breathing. Fourth, do not insert anything into their mouth because it will cause any choking or any breathing. It will cause their breathing to be ceased. And lastly, you are supposed to monitor and document the duration of the seizure. That means you have to time how long the duration of it, and also you just have to see how severe it is. So I will pass on to the next speaker, which is Puchi. Thank you.
Okay, thank you Liana. I'm Putri. So today I'll be talking about the indication and contraindications for lorazepam and sodium valproate. Okay, so firstly I'll be talking about the indications for lorazepam. So lorazepam is indicated for the management of anxiety disorders for the short-term relief of symptoms of anxiety or anxiety associated with depressive symptoms. Secondly, status epilepticus, where the drug will have an anti-seizure effect for 6 to 12 hours, and pre-op sedation to relieve their anxiety before operation. Okay, next, lorazepam is contraindicated in patients with acute narrow-angle glaucoma because lorazepam has pupil-dilating effects, which may further interfere with the drainage of aqueous humor from the anterior chamber of the eye, thus worsening narrow-angle glaucoma. Secondly, depressed respiration because lorazepam can cause respiratory depression, apnea, airway obstruction, and oxygen desaturation. Thus, is more likely to cause adverse pulmonary conditions. Thirdly, hypersensitivity to benzodiazepines. Okay, the next drug is sodium valproate and is firstly indicated for the management of wide range of seizures, such as simple partial seizures, complex partial seizures, absent seizures, and tonic-clonic seizures. Secondly, it is used to treat bipolar I disorder, impulse control disorder, and behavior agitation. And thirdly, sodium valproate is an effective prophylaxis against migraine headaches. Okay, sodium valproate is contraindicated in patients who are pregnant because it can affect how the baby develops in the womb and cause birth defects, including minor malformations such as small fingers and major malformations such as spina bifida. Secondly, is liver disease because valproic acid and its analogues are hepatotoxic and are contraindicated in patients with hepatic disease or significant hepatic dysfunction. Thirdly, is hypersensitivity to valproic acid.
Thank you, Puchi. I'm Joey. I'm going to talk about the mechanism of action of the drugs and the special points. So the mechanism of action for lorazepam is basically it's a benzodiazepine with anxiolytic, anti-anxiety, anticonvulsant, anti-emetic, and sedative properties. So it enhances the inhibitory neurotransmitter gamma aminobutyric acid on the GABA receptors, and it binds to the site that is distinct from the GABA binding site in the central nervous system. So sodium valproate it prevents epileptic fits by stabilizing excessive electrical activity in the brain. It is thought to achieve this in two ways: by increasing the activity of a natural nerve calming agent called GABA in the brain, and by preventing electrical signals from building up in the nerve cells in the brain. So the special points for the drug. So for lorazepam, you have to inform your doctor if you have any glaucoma, seizures, lung, heart, or liver disease. Meanwhile, for sodium valproate, please ensure you are not allergic to any of the ingredients on the leaflet on the back. So some symptoms of an allergic reaction include skin rash, itching, sharpness of breath, swelling of the face, lips, or tongue, which can cause difficulty in swallowing or breathing. Yeah, so now I will pass on to Farzana to talk about the adverse effects of two nursing considerations.
Thank you, Joey. I'm Farzana, and I'll be talking about the adverse effects of the drugs. So the drugs, as mentioned by my friends just now, is lorazepam and sodium valproate. So as you know, lorazepam is an anti-anxiety drug and it has sedative properties. Therefore, patient will experience drowsiness, visual disturbances, and also bone marrow suppression. Similar to lorazepam, sodium valproate also has similar adverse effects. However, these are the other three side effects that patient may experience when taking sodium valproate. Patient may have abdominal cramps, photosensitivity, and hepatotoxicity. Next, I'll be talking about the nursing consideration of an anti-epileptic drugs. So firstly, before administering anti-epileptic drugs to patient, we are supposed to obtain a drug history to check for any allergy, hypersensitivity before administering the given drugs, as it can cause development of possible anaphylactic shock. Secondly, we are supposed to ensure that drug administered is correctly and as per doctor's order, such as correct route and also correct dose prescribed. This is to ensure therapeutic effect and it is at its optimal level. Thirdly, we're supposed to observe for any characteristics of seizures such as the frequency, duration, and symptoms for reduced or increased occurrence after treatment. Rationale behind this is to monitor the response of patient to the treatment and evaluate therapeutic effect of the drug given, which is diazepam. Fourthly, it is to monitor patient's coordination and balance periodically and assess conscious level to see whether patient is confused or disoriented. The reason behind this is because anti-epileptic drug may cause adverse effects such as drowsiness, hypotension, which increases the risk of fall and injury. And lastly, we are supposed to monitor patient's full blood count such as red blood cell, white blood cell, and platelet count. The reason behind this is because anti-epileptic drug may cause adverse effects such as bone marrow depression, which might prolong bleeding time.
Okay, hi, good afternoon. I'm staff nurse Joey. You are Miss Akila, right? And
I'm her mother and I'm her sister.
okay, so I'll be teaching you about patient education for epilepsy. So, okay, do you know what to do when there's a seizure? Basically, the most important thing you should do is to loosen her tight and restrictive clothing, because this will restrict her breathing. And then you should also cushion her head to avoid injury to her head. Turn her to a side-lying position. This can prevent the falling of her tongue, which will obstruct her airway.
Can I insert anything to her mouth, such as spoon?
You should not force any objects into her mouth, because this will push her tongue backwards, which will obstruct her airway, and it can also cause injury to her gums or teeth. You should not restrain the patient as well, because restraining can cause further injury, such as fracture or dislocation. So, do you know when to call for medical assistance? So, the seizure should not last for more than 5 minutes. There should not be a slow recovery or any follow-up with a second seizure. If the patient shows signs in difficulty in breathing or other signs of injury such as fracture or bleeding, you should call for medical assistance. Okay. You should also take your medication correctly. Okay, because medication can help control the seizures and reduce relapses.
Can I stop the medication if the patient has recovered from seizures already?
No, you should take it consistently and not just stop abruptly. Okay. Do you know that you can also wear a medic alert bracelet? This can help for early detection in case of any attacks during when you're out in public. Do you have any questions?
Is there any contraindications for the medication that my daughter is taking?
Okay, so your daughter should avoid alcohol as it can increase the sedative effects of the anti-epileptic drug.
Okay, is there any future appointment that my daughter should take note of?
Yeah, she should return for laboratory tests to prevent drug toxicity. Okay. You all should also closely monitor her blood pressure as it is a serious adverse effect of the medication lorazepam that she is taking.
Thank you.
Thank you.
So these are the questions for the group. So I hope you guys are able to answer the questions assigned to each group of it. So this is our reference, and I hope you guys enjoy watching our presentation. Thank you.